Hi, Bob Lightfoot here from Reinhard Berner Van Duren, and today is Friday, May 22nd. Would like to give you my weekly update. There have been a few developments this week, especially with regard to testing. Let's start out with visitation, though. This continues to be an issue and continues to be something I get a lot of calls on. So I will tell you that just a few minutes ago, before I started recording this, DHS did come out with a GovD on the listserv clarification regarding testing and visitation guidance. This is for assisted living, but I believe you can take this to the bank on nursing homes as well. So first of all, the takeaway here is in terms of the DHS guidance, nothing has changed in terms of visitation. It still is to restrict visitation, to restrict non-essential health care, except for compassionate care situations. It's still to screen people, having visitors wear face masks. Nothing has changed that I can see. So, I agree with it or not. That's what we're faced with right now. I am reminded of something that I was thinking of, though. I know with the way everything is reopening and starting to reopen in our state, people kind of wonder, well, why can't we have increase in visitation? I think the one thing you have to remember is that you and I, when we go out and maybe start patronizing places, we're much more healthy than the people we're caring for in our facilities. So it's a little bit like comparing apples and oranges. Just because I can go, to a restaurant that may be opened and social distance and all that, doesn't mean that necessarily people should be coming at this point yet into assisted living facilities and nursing homes, because as you know, that's where most of the deaths are occurring and continue to occur. So we still have to protect those people, like it or not. That's where we are. And as I keep going back to, remember that immunity provision that we drafted that went into effect during the emergency declaration, which covers providers during the COVID-19 pandemic for liability claims. That ended May 11th essentially, and there was a provision in that statute that for 60 days after the emergency declaration you're still going to be covered, and so that's going to run out sometime in July. But remember, one of the provisions of that is you're only going to be covered if you're following local, state, and federal guidance. And really, the federal and the state guidance, I just checked CDC and CMS. There's no renewed guidance for visitation on there. However, at least CMS is starting to think about this. And some of the things that CMS, in a memo, if you just would happen to Google CMS 20-30, this memo will pop up. And at least is something that is giving us a glimmer of hope for when we can start to open up visitations. And some of the things they talk about are factors that will inform decisions about relaxing visitation restrictions in nursing homes include the following things: case status in the community. So, how are cases in the community declining or rising? Case status in the nursing homes. Have you, and remember this is CMS, but you can easily think that this will apply to assisted living as well. Have you had new cases? Are you having an outbreak? That is going to affect it. Do you have adequate staffing? Do you have adequate access to testing? I'm going to talk about testing in a minute. We're expanding testing. Nursing homes are required to do the testing now. Assisted living is not going to be far behind. So access, do you have access to testing? Is there source control? So are you still going to have residents and visitors wear a cloth face covering or a mask? Are visitors willing to social distance? Are they willing to abide by any rules or methods that you have in place for visitation, like having the visitation in a separate area or outside? Do you have adequate access to PPE? And what's the local hospital capacity? So at least it's being talked about now, where it wasn't. Even like as recently as last week, it wasn't being talked about. This memo's dated May 18th. So there is a glimmer of hope. Just hang in there. it's tough. I'm getting calls with irate family members. I get it. But if you want to be covered under the immunity statute, you got to follow the local guidance. Okay, let's talk about testing. Yesterday, on the 21st, was the nursing home weekly webinar focused almost exclusively on testing. Now, this is nursing home testing, remember. What's happening now is over 200 facilities have requested testing. The way that you do that is to get on the NHSN information to sign up and get all the materials. Remember, this testing is free. It's paid for by the state. So for information on just overall on the program, you will want to Google CDC and NHSN. For Wisconsin specific information, you are going to want to Google WI space DHS space NHSN to actually fill out the form, order the kits, and proceed with testing. So what do we know about testing, and what do we know about what's going to happen necessarily with assisted living? Well, right now the goal is to have all the nursing homes be enrolled in and start testing by the end of May. And I think, if I'm right, assisted living will probably follow that. So again, when I look on the DHS website, I see the NHSN enrollment, facility setup and navigation, and so that's really all the information you will need to get started right there. NHSN, by the way, is the National Healthcare Safety Network. Somebody had asked me this week about the accuracy of the testing. They're saying that the error rate is about 26 out of 50,000, so that's a pretty good test rate. And nursing homes may use the state epidemiologist standing order that's on the website as well. If you have a positive resident, you will get a phone call, and I gave you the references for that before. There's additional information if you Google CMS 20-29. That will give you some additional information on the NHSN nursing home testing. Let's skip, since we're on nursing homes, right away to the nurse aid training issue. And as you know, the nurse aid training expired on May 11th, along with the emergency declaration. So they're in a little bit of a bind in terms of continuing any emergency nurse aid training programs you have. Fortunately, the state has said all you need to do is request a waiver to continue that process. And the waiver process is very, very simple. You don't even need the form. You just simply need to email to DQA your waiver request. It needs to have the following language in it. Quote, "We are requesting a waiver for all applicable regulations to allow for the continuation of the nurse aid training program in our facility," end quote. So that's really all you need to do is send that in. You'll get a response in 1 to 2 days, and the email address is widqa_NATCEP@dhs.wisconsin.gov. Again, that's widqa_NATCEP@dhs.wisconsin.gov. So hopefully, that will help you continue your nurse aid training program. All right, let's finish up here with a couple other items. Yesterday, the governor announced the CARES Act went into effect in terms of Wisconsin having requested $100 million for use by nursing homes and assisted living facilities. Thankfully that will be there. We don't know the specifics yet, unfortunately, but hopefully when we get those, we'll pass those along to you, and I will pass those along to you in another video. If you want to see the governor's announcement on that, you can log into WIS wiseye.org, and along the right-hand side is his media briefing from 5:21. You're going to want to advance that to the 7-minute mark to get to the discussion about the CARES Act and the money now that's available. Another random issue I'll talk about briefly. We're still getting questions in our law firm here about the PPP loan program, specifically whether people should apply. How do you calculate the 75% for wages? We have some great folks here at Reinhardt that have been working with our healthcare clients on these issues. Just send me an email. I'll put you in touch with them, and they can talk you through your issues, and clients have found that very helpful because there have been a lot of issues with regard to the PPP loans. Let's see, after July, when the immunity statute runs out, people are wondering about how are we going to be covered. Well, we're going to try and work on extending that immunity provision, but if not, I am trying to develop a form that you can possibly use to extend your liability. It's going to look probably like an RCAC risk agreement because during my research I discovered that no liability waiver form in Wisconsin has ever been upheld by the Supreme Court of Wisconsin. So it's a little bit of an uphill battle there, but there may be a way to do that with a risk agreement form. So I hope you have a great Memorial Day and Memorial Day weekend. I know the weather's not supposed to be the greatest, but get outside, enjoy it. And if you have any questions, as always, you can email me at Reinhardt. Follow me on Twitter at Bob Lightfoot. Look me up on my LinkedIn account where I constantly provide updates there as well, or follow me on my Facebook, Robert Lightfoot. So have a great weekend, folks. Thanks. Bye.